So today's our 18th video, and I'd just like to take a moment and thank our staff for their continued hard work. So it's been over a year since this pandemic hit this area. We have made incredible advances on all fronts, but at the end of the day, we've continued to advance the care of our patients in our community. We feel very fortunate to be where we are today, and that we see the light at the end, and we're getting there. As everyone knows, last week the CDC came out with new guidelines around mask wearing and social distancing. We have taken the last few days to go through that and evaluate what that means to Sarasota Memorial and our community, and how can we continue to protect our patients and our staff during this pandemic. We've had Dr. Gordillo, Dr. Fiorica, and other medical staff leadership review this. So we are having several changes happening with masking requirements throughout the SMH community. But some of the things won't change. We're still requiring our guests to wear masks in the public areas and in our patient rooms, as well as our caregivers and other team members. As always, our top priority is the safety of our patients and our team members. As we've done throughout the pandemic, we've continued to evaluate our visitor policies, and we've changed those over time as we've gotten more evidence of what's going on through this pandemic. I'm happy to report that we're relaxing some of these visitor restrictions right now. We want patients to have their family members by them at the end of the day. I would encourage you to go to our website and look at the new rules because they're a little bit different in every area. But at the end of the day, we're going to expand the hours and we're going to expand the number of visitors that can come visit patients. A lot of good news around vaccinations. All adults in Florida, and quite honestly, most of the nation, can now get a vaccine. They're very readily available. We highly encourage you to go get the vaccine. It saves lives. Hundreds of millions of people worldwide have gotten this vaccine, and it has been proven safe and effective. Please take your shot. We still see people every day contract COVID that have not taken the vaccine. And some of those people are hospitalized, and even some of those people end up being put in ICU and on a ventilator. And unfortunately, we still see some of those pass away at the end of the day. We are seeing the light at the end of the tunnel, but we still have a bit of the tunnel left to go. We still need people to take the vaccine. It makes a difference. One of the things that I have done personally throughout this pandemic is I've had nursing email me each time someone passes away in our organization due to COVID-19. I've noticed several things that have changed over the last couple months. One, our average age of patients in COVID has gone down significantly. We were in the high 60s, low 70s of average age. We're now down into the 50s. People believe that if you get COVID and you're young, that you're not going to be susceptible to losing your life because of COVID. And I just want to share a story with you telling you that that's not the case. Last week, we had 4 patients pass away at SMH. 3 of them were under 60 years old and 1 was under 50 years old. Every time I got a notification, I would ask myself, what could we do differently? How can we advance the cause? How can we keep people from getting the disease and ultimately getting hospitalized? If they are hospitalized, what treatments can we bring to bear that can make a difference and save their lives? So throughout this past year, I've received almost 250 notifications of deaths in this hospital due to COVID-19. I'm very much looking forward to the day when I receive no more. Thank you all for continuing to watch these videos. We very much appreciate it. We very much appreciate everything that you continue to do for our community, for our patients, and for our team members. I want you to stay safe out there. If you haven't gotten your shot, get it now. Thank you so much.